1. Open the sterile packaging of the PEG kit. The kit should contain the following items. 2. Perform endoscopy and guide the gastroscope toward the anterior gastric wall. 3. Thoroughly sterilize the area, then administer local anesthesia. 4. Identify the area of maximal transillumination and confirm the selected site using external finger indentation. 5. Make a transverse abdominal incision to allow easy passage of PEG tube and its accessories. 6. Introduce a large bore needle with a sheath through the incision until it enters the stomach. Ensure that no hollow organ or blood vessel lies in the intended puncture path. 7. Advance the loop wire through the needle into the gastric lumen. 8. Using an endoscopic snare, grasp the loop wire visualized within the stomach. Carefully withdraw both the wire and the endoscope through the patient's mouth. 9. Pass the wire tip through the open loop at the end of the feeding tube. Open the wire loop and pull the internal bumper of the PEG tube through it to secure a knot. Adequately lubricate the PEG tube, then pull the wire from the abdominal side until the tapered end of the tube exits through the incision. Cut the loop wire to separate it from the snare. 11. Slide the external bolster into place approximately 1 centimeter from the skin. 12. Apply the clamp. Next, secure the PEG tube using the silicone bush. Lastly, trim the excess tubing as per patient requirement and apply the bolus feeding adapter.